Let's learn all about speech and language impairments. First things first, we have to define a few things. What is speech? It's actually the expression of making sounds. So it's a few different things together, like respiration or the act of breathing. It's phonation, or the ability to produce sound using your larynx and your vocal fold. And it's articulation, and that's the idea of using your tongue, your lips, your teeth, the hard and soft palates, all those parts of your mouth to form different sounds. Language is then the use of signs and symbols. And communication is actually the exchange of different ideas. It's very important, especially as a teacher, to know those different milestones by specific ages that are quote unquote typical. So in general, by age 1, there are a lot of different milestones that you should be watching for, or if you're not seeing, it could be a red flag. By this age, children should recognize their name. So when you say their name, they should give you some sort of feedback, some eye contact, a smile, look your direction. This is about the time they're saying their first words. They start to imitate you. It could be with sound or just with nonverbal communication, like you smile and then they smile, or you wave and they wave. They begin to understand simple instructions, and they start to recognize that words are symbols for something else. So if you say, "Where's the dog?" Dog means, in their mind, they're picturing what a dog is, and they understand that that word means the dog in the family room. This is an example of actually two children. They are both in my family. The little boy is the third born, and he is about 11 months old. He's a male. And the little girl who you see here is an 18-month-old female, firstborn. And you're going to see some of those milestones in this video. Let's watch.
Come on, Dave, I'll play. Come on.
Julie, you have a purse?
Julie, she's wild.
Julie's fine.
I got up with Uncle Dave. Come on, Uncle Dave.
You want your same side? I don't care.
The silver one on the table, the little one. Jackie, did you decide about
So both of these children they're actually cousins. They're very close in age, but you can see some of those milestones in this video. You see the little boy put something in his mouth, and the little girl comes up to him and takes it away and recognizes that you're not supposed to put those things in your mouth, and then shakes her head, and she's saying, "No, no." And the little boy is just starting to recognize what that means. He tries it again, and then he eventually gives up and goes for something else, to put something else in his mouth. So those are some of those milestones. There's not a lot of spoken language in that example, but remember, we're talking about receptive as well as expressive language development. We'll get into what that means. When children are 1 to 2 years old, they have a few more milestones. Now they're understanding what no means. They're actually using about 10 to 20 different words. They have about 10 to 20 word vocabulary. If you were to ask them to give me the ball, they should be doing that. They're combining two words like bye, dada, or more, mama, or more milk. If they see an animal, or you ask them, "What does the dog say?" they might make that animal sound. Those are typical milestones in development. And this is when you start to play all those games like, "Where's your nose? Where are your eyes?" And they should be able to point to those things. Here's an example of an 18-month-old. Same little girl from the first example, but now you're going to see her interact with my firstborn daughter who's coming towards her and my second-born son. So this is their cousin, and she's going to say bye to them.
Hi.
Give Emmy a kiss. You can give her a hug and a kiss.
Can I have a hug?
No.
Now she said hi.
Bye. Bye bye.
All right, come on.
Bye.
No, no, bye.
Bye, Lucia.
Boys are always the hardest.
What did she say?
Bike and shoes.
Walk?
Walk.
Okay, she's
go
gonna
in the
walk
car,
home.
Okay? They're gonna walk home. Whoa, whoa!
You can't walk home, silly.
Julie, are you taking?
So in that example, you see her, Lucia, the little girl in the blue and white dress, follow some instructions that the little girl who's older says. I think it's me saying say bye or give Emmy a kiss. She says no. They like to say no very early on, but then she does it. She gives her a hug. She makes a kissing sound. She goes up to the little boy and she kind of leans in like a hug and makes a kissing sound. She says bye, no. She's saying goodbye to Nolan. She's combining two words. She also is understanding walk. She's saying walk, and she's showing you that they're walking on the sidewalk. But then she tries to go for a walk herself, which the mom stops her. But the mom is my sister. Okay, when children are about 2 to 3, and remember, development is nonlinear. So some children might be meeting these milestones very early on in 2, and then some may be in the middle of the 2 to 3 age range. Some of them may be meeting them later on at 3. It's when they're not meeting them at the end of this age range that you start to just take a closer look and make sure that they are meeting these milestones. This is when they are identifying body parts and saying eyes, nose, knees, belly. They have about a 450 word vocabulary, and they start to ask a lot of questions like, what's that? They put two words together like no want. They also combine noun and verbs like mommy go. They should be able to tell you their first name if you ask, and or hold up how many fingers they are in age. They start to use plurals. So instead of saying if there's 3 dogs, they should be able to say dogs and add that S. They start to carry on conversations. So there might be some baby talking, da 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 da, and then some conversation back and a wait time, but it's a conversation. There's back and forth, even if it's not a lot of real words. They start to use the word me instead of their name when they're talking about themselves. They can solve problems by crying or hitting. That's a big milestone. So that's a normal thing that children between the age of 2 and 3 are going to do at this age. And they like attention. They're often asking you to watch them or trying to get your attention to see what they can do. So in this example, you're going to see this is my daughter and my son. My son is the one you're going to be watching. He is about 2 years old and 10 months, and he's the second born, and he's a male. And you're going to see an example of his language and crying to solve a problem.
Ingredients.
Okay.
It's water and cornstarch. but I don't know which one was first because our mom made it. Ah! Daddy! Sorry.
Nolan, do you want it off?
Yeah.
Okay, I'll get it off. 1 minute. So that's a very typical scenario that you're going to see between the ages of 2 and 3. And for some reason, adults and teachers and a lot of people who don't study child development seem to think this is whining, complaining. It's a very difficult stage. You hear about the terrible twos or the three-nagers. This is typical. They're still developing the vocabulary. They don't have all those words. So they hit or they cry to solve a problem. Nolan in this video says, it's on me. And he's trying to explain how upset he is, that he doesn't like how it's feeling. He wants it off. He actually says some words too, but then he begins to cry. And you can hear me try to calm him down and say, do you want it off? Okay, I'll get it off. And that's when we stop and we clean him up. But those are very typical milestones. That's what you want to see at that age. Now, if you're seeing that at 6 and 7 and past 3 into 4, that's a red flag. That's when they should have more language. Let's talk about 3 to 4-year-olds. This is my workplace. I love working with this age group. So I tend to work with 2.5 to 5-year-olds, and there are so many fun things that happen within this age range. When they are 3 to 4, they should be telling a story using some sentences with 4 to 5 words. They have about a vocabulary of around 1,000 words. They are naming some colors by name. If you ask them, what's this? They may not know all the colors, but they'll know some colors. They should be able to obey some requests. They know their name, and if you ask them their name, they tell you their name. They may know where they live in some aspect, like Ohio or Strongsville, or they may say parts of their address. And they begin to sing and know some songs or some simple rhymes like nursery rhymes. So in this video, you're going to see an example of some of these milestones. This is that same little girl from the other videos. You can see my children in the background. Emmeline is sitting down. Nolan is in green. Weston is my third born. He is about just 3, maybe, not quite 3 in this example. And Lucia is the one dancing. She is about 39 months, so 3 and a few months old. And you're gonna see her vocabulary kind of exploding here.
Oh, baby, why don't you see me in the middle?
Oh, I know the song.
It's my mind just a little. So why don't you just see me in the middle? In the middle.
Gosh, where does she get it?
Why don't you just meet me in the middle?
Wow, these are some great moves.
My mind just is a little.
Look at, he's doing it too.
Just meet me in the
I love this song. It's a family song. I'm sure Eric hates it.
So this is an example. Obviously, you can tell that I videotape my children and my sister's children often. I'm always sort of using them as test subjects for school, and they make the best candidates. And we're at a family party, and Lucia is just 3 years old, and she sings many songs at this age. She has an extensive vocabulary and a good memory. When children are about 4 to 5 years old, they have even more of a vocabulary. They should have about 1,500 words. They're using the past tense. So they might say, we went to the store instead of we go to the store. Or they may do that ineffectively, like we goed to the store, but they're adding that past tense to it. So they're still exploring it. It may not be perfect, but now it's not the same as the present tense. They ask a lot of why questions. This is when they can identify simple shapes, maybe not all of them like octagon or cube, but square, circle, triangle, they tend to identify those at this age. They also begin to understand next or in the morning or basic concepts of time. Like first we're going to do this, then comes blank. But this does not mean that they are understanding what yesterday is or next week. Those are really, really abstract concepts. And that perception of time doesn't come till age 8. So it begins to happen around age 8. So they're just understanding kind of basic concepts of time. This is an example, again, of my preschoolers from a few years back. This is a 4-year-old female. She's the second child in her family, and you can hear her beginning to explore past tense. She doesn't do it exactly the right way, but you can see that development happening.
With the carpet on top, it would sink right into the pot.
You're right. If the hole was here before, our carpet would have sinked down in it. I think you're right. Yes.
I think it just went all the way up to the top.
You think it went what? The water went all the way to the top?
Went on the top of the carpet. Need to go potty.
Go ahead, you can go potty. So, Soraya, you think the water. Show me what water.
The water
The water in the ground.
And I think it might go on the spot.
It just kind of came up and got higher and higher and higher and higher and then made the spot? Can you tell me about it? Aha! So in this example, you may be wondering, what the heck are they doing? This preschool class, this was their classroom, and we noticed a wet spot on the carpet, and it got bigger and it got bigger, and we realized that it was coming from under the carpet. So the church where we rent space actually had to relocate us for the year, but our class needed to investigate. So when we went to our classroom to see what was going on, we noticed the carpet was removed and there was a hole in the ground, and they remembered the spot. So they're remembering, all these children are 3 and 4. They're remembering what had happened, like before when we were in here, there was a wet spot. The wet spot was here. Now the carpet's gone. And they're trying to come up with ideas of, well, why is this hole here? Where is this water coming from? They're trying to make connections. So you're seeing lots of thought process, lots of different vocabulary, lots of different questions. Actually, they're giving the ideas. Before this video started, they were asking the questions, and that's why we came to the spot. And at the beginning, you saw the little girl say, instead of it sank, it sinked down. And I repeated it so you could hear it, but she's exploring past tense. So she knows the word sink, or, went down, but she doesn't quite have sank yet. So she added the ED, sinked or sinked. When children are 5 to 6 years old, they're kindergarten age. So keep that in mind when looking at all of these milestones and what's quote unquote normal. This is when they only have 5 to 6 word sentences. They have about a 2,000 word vocabulary. They're defining objects by their use, or they're able to. So they understand that scissors are for cutting. A hammer hits things. So besides just the name of the object, what it's used for. That's a huge component of language. They know spatial words like on top, behind, in front of. They know common opposites like in or out, hot or cold. They can count 10 objects correctly. They know same versus difference. They're using lots of different types of sentences. So they may be asking questions, using compound sentences. First I went to the store and then we went to the park. They ask questions to gain information. They're differentiating between their left and right hand, and they know their address. Not all of them will know their entire address, but again, they know some part of it. With all of these things in mind, keep thinking about what we expect our kindergartners to do. Because my kindergartner is expected to be writing sentences. And that's not where their ability is in language development yet. If they can only form and speak 5 to 6 word sentences, they really shouldn't be writing them yet. Some of them may absolutely be prepared for that, but not all of them. It just gives you a good idea of how curriculum has kind of gotten far away from, and standards and assessments, far away from what children this age are actually prepared to do and able to do. This is my daughter, who's the 6 years old in this example, and she just turned 6. She is the firstborn, and she's describing her drawing.
That is Baba Joe's daddy. He's shooting some of the rainbows. It's magic. And that's Cege's mom. It's shooting magic like Baba Joe's dad. And that's Baxter. He's shooting magic too to make a rainbow. And these are all kinds of fireworks. I'm adding a new color for their shirts.
Where are they?
They're in heaven.
What does heaven look like?
Heaven is in a cloud.
Clouds. It looks just like them.
And that's the sun. And that's their shirts I just did. And now I want them to see fireworks. So I'm going to make some.
So she is drawing with window markers, and she's describing heaven because she names all these people who have passed away, and she's telling me that they're in heaven. Heaven's in a cloud, and she's drawing. So she's not only explaining with detail and vocabulary, but she's being creative. She's using critical thinking. She's also beginning to put her ideas in drawing. So that is a prerequisite for writing. At this point, she's able to write a few words and read some sentences. But before children can write, there are like 60 stages of scribbling. And then they begin to draw, and then comes the writing. So they have to go through all those stages. So this is a very valuable and important stage, and it shouldn't be disregarded as just playing. This is writing development and part of language development. Now that we've covered the milestones of language development, let's talk about what language is. There are 5 different components of language. They're listed here: phonology, morphology, syntax, semantics, and pragmatics. We'll go through each one. There are 2 different types of language, and with that, there can be different language impairments in each of these areas. Receptive language is the ability to understand what is meant by spoken communication. So this is not when a child or an individual is speaking. And think of the examples of when that little girl was told to say goodbye. She didn't immediately say goodbye. She gave a hug goodbye. So she's understanding. She's receiving the language and understanding it. If there is a deficit in receptive language, then it's going to address retention, recalling issues, or responses. You're going to see those areas affected. Expressive language is the production of language. So this is when not only is it understood, but it's meaningful to others. Expressive language skills and possible areas of deficit would be in grammar, syntax, fluency, vocabulary, and even repetition. So expressive language is when you ask a child to tell me about what you're doing, and they're able to put that into words and sounds that not only make sense, but you can understand. Here are the basic components of language. There is a graphic in your book on page, in my book, it's 337, but I didn't really like that graphic, so I tried to remake it, and I can see that I cut off part of it, so I do apologize for that. But you can see that from the top, the part that is missing, let's see, it should be morphology, phonology, syntax, semantics. So it's semantics and pragmatics. Looks like I'm missing two. I'm sorry. So that's a terrible graphic. I'm going to have to put the regular one on Blackboard to fix that for you. But if you don't like the graphic that's in your book that breaks down what language is into those 5 sections, then you can look at the one on Blackboard that I will post. Now, we're going to go into each one of these in the next few slides. Phonology. What the heck is phonology? This is the sound of language. So it's the rules that tell you what to say and when, where the stress is, where the intonation patterns are, and any accompanying sounds. So when we talk about what a phoneme is, that's a part of phonology. I don't know if you remember, but back when we were talking about specific learning disabilities, we talked about phonemes and the smallest measure of a word and the sound of it. So the phoneme is part of phonology. Think of phone like you're talking. If there is a deficit, so a disability in receptive language in this area, phonology, that would be a difficulty discriminating between different sounds that someone hears. So a child who hears truck and duck, they would have a very hard time hearing the ch or the d. It's hard for them to receive that. When expressing it, they would also have a hard time articulating those sounds. So those sounds are going to be mixed up, or they're not going to be clear enough for you to understand them. And we're going to see some examples of that. Morphology, this is the rules that tell you how words are formed in the basic elements of the meaning of them. So if you're going to have a deficit or an area that you struggle with receptive language in morphology, then you would have a hard time understanding grammar structure. But if it's expressive difficulty, then you would have a hard time using proper grammar in words. Rules for how to put words together to form a phrase or a sentence. Basically, the relationship among the elements of a sentence is called syntax. Someone who struggles with receptive language in syntax would have a hard time, again, discriminating the different sounds they hear. And if it's an articulation problem, it would be an expressive difficulty in syntax. This one's very similar to phonology. Semantics is a little more complicated. So this is the meaning of words and sentences. And that's the only definition that I really am requiring you to know. So the meaning of words and sentences, but the longer version is the linguistic realization of what the speaker knows about the world. Complicated, I know. So if there is a disability in receptive language for semantics, they would have a hard time understanding word meanings. And then if it was an expressive difficulty, they would mix up the meaning of the word they're using. So they may actually say the wrong word for what they're trying to explain because the meaning is the part that they're complicating. Okay, this is the last one, pragmatics. These are the rules related to the use of language in social contexts. So this is kind of like the effectiveness of language in getting your point across. If there is a difficulty in the receptive language in pragmatics, someone would have a hard time understanding the social and context clues of being told something or reading something. And if it was an expressive difficulty, they would have a hard time using language to affect others. We talked about language, parts of language, and typical language development and milestones. So now let's get into what it means to have a speech or language impairment. This would be a problem in communication or a related area like oral motor function. Delays and disorders could range from something so little they have no impact on socialization or daily life, or it could be so severe that someone is unable to produce speech or unable to understand and use language. The IDEA 2004 label for students with communication difficulties is called speech or language impairments. That's the category that you would see on an IEP. Children are eligible for services in that category if they have a communication disorder like stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects their educational performance. So again, they may have one of those things, but if it's not affecting their ability to learn in school, then they may not qualify for an IEP. Just because you have one of these disabilities doesn't mean you automatically qualify. It has to interfere with their educational performance. And most of the time it does. The definition from the American Speech and Language Association of a communication disorder is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbols systems. You don't need to know all of these definitions, but it's important that you're aware that that definition is slightly different from the label from IDEA. Language difficulties that are secondary to other disabilities could include these areas as well in phonology, morphology and syntax, semantics, or pragmatics. So, what the heck does that mean? Well, it could be that if someone has autism, they may also have a secondary disability in language. This is when we talked about that comorbidity. When we talk about intellectual disabilities, if a child has Down syndrome, they may also have a speech and language impairment. If someone has a traumatic brain injury, their speech and language could be affected. So there are lots of different possibilities where you could see this combined with something else. In learning disabilities, phonology, the area of phonology, you may see delayed acquisition of words or sounds, not great production of complex sounds, impaired sensitivity to sounds. In the morphology and syntax area, you may see shorter, less elaborate sentences. You may see trouble encoding the relevant information. These are all the things when we talk about learning disabilities, think about dyslexia. So if someone has dyslexia, we know that it's a learning disability, but they are also going to have problems encoding, decoding. They may have shorter sentences. They may have not as good use of phonological codes in their short-term memory. So these things tend to coexist. Let's talk about speech disorders. A speech impairment is present when an individual's speech deviates to such a degree that it interferes with communication. It may even attract unfavorable attention. It could adversely affect the listeners, the speaker, or even both. One of the most prevalent of all speech problems is articulation. So this is an error in the production of sound, and it can be in any one of these areas or more than one. So when we talk about an articulation disorder, it could be that the person is omitting sounds, and that's when they are just not producing one of the sounds. So instead of saying hand, I raised my hand, I raise my hand, and they don't say the D. That's omitting a sound, omissions. If it's a substitution, then it's when one sound is substituted for another in a word. So this is really common. You hear the Easter wabbit instead of rabbit came, although it's bunny, right? not rabbit, but I saw a wabbit, and they're saying w instead of r for rabbit. That's substitution. Addition is where they add extra sounds in spoken words. Trying to think of an example for that, but it might be an extra actual whole syllable. I can't think of one off the top of my head for additions. I'll see if I can find you an example. Or distortion. So that's when a sound is just said incorrectly, but it resembles the intended sound. So we went and we saw a pirate sip, but it's ship. Well, no, that would be like a deletion, an omission. So if you said ship instead of sip, I took a sip of the coffee, but you really took a sip. It's kind of distorting just a part of that sound. So not taking it out, but changing it. There are lots of different options for therapy for articulation disorders. Again, this would come down to the speech and language pathologist to provide, but this is when those professionals would be teaching explicitly the place in which your tongue would go to make specific sounds. There's lots of tricks and tools that they know. They often share them with classroom teachers. There may be a signal. I'm trying to think of a few that I used with my son. When it was a TH sound, they would tell me to put the tongue by the teeth and like push it in a specific place. So when my son was struggling making the th sound, I would use the same indicator and the words that they would use so that we could reinforce. Most importantly, what do you do when someone is struggling with articulation? Whether or not you are trained in this, a student is receiving therapy or not, if a student's not articulating correctly, don't make them repeat it. Instead, the best thing you can do is model the correct language articulation. So when they say, I took a sip of my milk, you would say, oh, you took a sip of your milk, and you're just going to accentuate and model the correct placement and sound. Making them repeat it does not help. It just confuses them. This is an example of an articulation from my son. You can see early on that his articulation is off. Let's watch this.
He wants orange sharp teeth. Yeah. I wonder what he's going to do with those sharp teeth. And a horn, sharp teeth. Want some more? What do you think? Want some more? He wants some more? Want a bad one? A bad one? Yeah. Bad one. A bad one that is nice? Yeah. There's a lot of them to pick. The bad ones. How do you know that one's bad? He wants horns? Yeah. I wonder where these horns are gonna go. A lot of them.
So in that example, my son, I believe, is about 3.5, almost 4. And I was kind of on top of his speech from the very beginning because he spoke late and he didn't articulate ever from the very beginning. You can probably pick out some omissions in that, maybe some distortions. I don't think I heard any substitutions, but he definitely omits. He didn't have the sh for sharp teeth, and I think it was like eeth instead of the teeth, and you could hear me just modeling the correct pronunciation and articulation for each one of the things he was saying. I got really good at understanding, but sometimes that's the hard part with children and working with families, because the families learn what the child is saying. But you have to try to remember and remind them and educate the parents that about 80%, by the time a child is 3 to 3.5, 80% of what a child is saying should be understandable by a stranger. So it doesn't mean that you can understand them and people who are close to the child is understanding them, but could a stranger understand about 80% of what they're saying? And that's kind of a hard truth to swallow as a family member, but that's often what I have to tell parents when I'm trying to explain that I think the child that we're talking about, they may benefit from some speech and language therapy, or at least an assessment to see if they qualify for it. Speech disorders come in many varieties. So there could be an impairment in fluency, it could be stuttering, it could be cluttering. And what's important for you to know is that there's many different types of speech disorders. Speech disorders are the most common and most complex for expressive language, and it requires a lot of coordination. It requires the muscles in the mouth to be working in the right way and in the right position. It requires breathing, voice production. A lot of different things have to happen in order for a child to speak correctly. So it's no surprise, especially with how much technology and less book reading that we're actually doing with young children and the increase of screen time, that we are seeing more and more speech disorders. A fluency disorder would be something that involves the flow of speech or the rate of the smoothness of how the speech is sounding. Stuttering is something that most people are familiar with, and it's kind of that rapid fire repetition of a consonant or vowel sound, typically at the beginning of words, but you may hear it at any point. You may hear it in hesitations, interjections, a complete block of what they're saying, and they just kind of stop talking, or they're going before it comes out. Most importantly, with stuttering, whether you're trained in speech therapy or not, one of the things they tell you is to not try not to rush a child who's stuttering. Just maintain eye contact, stay calm, and wait. And don't say, "Come on, you can do it. What is it?" Or, "Okay, tell me when you're ready." You just wait. And you give them time. And that's the sometimes most difficult thing you can do, but it's the most beneficial to the student who is stuttering. Cluttering is related to a fluency disorder. It's excessively fast and jerky speech. Sometimes it's disorganized, talking too fast or in spurts, or being unsure of what they want to say. So not stuttering, but cluttering. If you think back to those 5 components of language at the very beginning of this presentation, you realize that there are phonology, morphology, syntax, semantics, and pragmatics. There's lots of things that have rules that a child has to master to have language competence. So a language disorder happens when there is a delay or a difficulty in mastering one or more of those areas. There could be many different types of language disorders. So let's talk about 2 of them. A phonological disorder is defined as abnormal organization of the phonetic system or a significant deficit in speech production or perception. A developmental phonological disorder is when a child has difficulty of organizing the speech sounds into patterns. A child with this disorder might be described as hard to understand, or they might not say the sounds right. They may have difficulty decoding spoken language, and they may make substitutions for sounds. Apraxia is a neurological phonological disorder that results from the impairment of the capacity to pick and execute the position of the speech muscles to produce the sounds. The speech mechanisms are working, but the child can't get them to work properly. When the child wants to speak, they have difficulty planning what to say and which way to move their mouth and which motor movements to use. There are also morphology disorders. A student with a morphology disorder has a problem learning and using morphological rules. They use fewer grammatical morphemes and produce more grammatical errors than most students their age. If there is a syntax disorder, then it would be a child who has difficulty learning the rules that govern word order and aspects of grammar like subject and verb agreements. They might have problem processing sentences, even simple ones. They may produce shorter sentences, less elaborate sentences, and have fewer cohesive conjunctions than people their age. A semantic disorder would be characterized by poor vocabulary development or inappropriate use of word meanings. It could be the inability to comprehend word meanings. This is most evident with word finding or the ability to generate a specific word that is evoked by a situation or a sentence or a context or conversation. If you have ever experienced a child who has a hard time attending to a speaker when there's noise in the background, of course, this could be for a lot of different reasons, but let's rule out attention or something really exciting. A child who really has a hard time discriminating the difference between the person who's talking and the background sounds, or the ability to maintain listening focus. This could be even a difficulty hearing difference between similar sounding words or sounds. This could be central auditory processing disorder. And it's basically a processing disorder that's not related to hearing loss or intellectual capacity. And it involves cognitive and linguistic functions that directly affect receptive communication skills. So we're talking about receptive language, not expressive, the understanding of the language. And this is basically when the ear and the brain are not working together. So this is something you may hear about. Again, we're not going to ever say, I think they may have CAPD or diagnose ever, but it's important that you are aware that this is another speech and language impairment. Speech and language impairments are very, very common, as I stated before. According to the U.S. Department of Education in 2018, slightly less than 20% of students who receive special education services are getting them for speech and language impairments. That's a lot. Almost half of preschoolers, it's about 43% of all 3, 4, and 5-year-olds with a disability have it in speech and language impairments. And I feel that that's going up for a variety of reasons, but there are lots of different explanations, and I won't even say explanations, but possibilities. It could be with, what's gone on just with technology in the past. It could be less reading and conversation time. Personally, I think a lot of the speech and language delays that I've seen go through the roof for the past 5 years. Well, 2.5 of those years we've been through a pandemic where we really haven't been around other children. And so they haven't developed or had an opportunity to develop certain speaking and listening skills because they haven't been around peers. So it could be for many different reasons. Let's talk about the professionals in this field, speech and language pathologists. So these people are the ones who would give the speech therapy services in a school district or privately. A family could opt to have speech and language therapy through their insurance or through the medical field. When I was going through the process with my middle son, we went through the school district and he was given an intervention specialist and a speech and language pathologist. He has been with that speech and language pathologist from kindergarten to the end of 3rd grade, and he recently graduated from speech therapy, which was very exciting. These, along with teachers, have many responsibilities, but the book points out 2 important responsibilities. One is to address children's specific language difficulties, and then 2, to minimize the social impact by promoting language understanding and acceptance of language difficulties. So basically, we're way past the days in which the weird kids were called out of the room for speech. Like, oh, there goes the speech group. They're going to work on talking. We're past that, or at least we should be. The speech and language pathologists, intervention specialists, and teachers owe it to children to, first of all, address specific language difficulties, so articulation, stuttering, whatever it may be, and then work on, with the rest of the group, that we all talk different. We all develop sounds different. I know in preschool, my son had a really great class, but of course he had really great teachers too, and they were just very accepting, and right off the bat, all of the students understood that Nolan, my son, was still working on his sounds. And that's kind of what they would say. He's still working on that sound. And they wouldn't say, what? Huh? What are you saying? I don't understand him. Because the adults were modeling, tell me again, I wasn't hearing that. Or I didn't hear that, my ears weren't working. And using those types of reminders to try to get Nolan to say it again. When you're having a hard time understanding a student, the worst thing you can do is ask them to repeat it a million times. So instead of saying what, or I don't get it, or I didn't hear you, we tried to put the blame on the teachers and say, I'm sorry, I wasn't listening. Can you tell me one more time? Or can you show me what that is? And then the students would immediately start doing the same thing. Another thing you can do is just explain that we are all learning at different rates. So point out how someone in your class is really good at math. And if somebody's struggling in math, you could say, you know, Dylan might be a really good resource. He's really good at math. Let's see if Dylan can help you. And when you point out strengths of other people, then you realize as a class and young students that not everyone is good at everything. So with my son, he was really good, and he is very good at building and working with his hands. Anytime someone was trying to do problem solving, they went to Nolan. He was very mathematical, logical, and they would go to him for that. He would then go to some other friends when he needed help with writing or drawing, because those are the areas he struggled with. Well, how and why do speech and language disorders come about? There are lots of different possibilities. Functional etiologies include environmental stress, for example. If it's some kind of organic etiology, that would be like a cleft palate, something that is organic in nature, like a child born with a cleft palate would have a speech and language impediment or a disorder because they would have an articulation issue because of the way their mouth is formed. There also could be congenital disorders or something that exists at birth that causes a speech or language impairment. So, that could be like a prenatal injury, problem with the muscular system or the nervous system, a brain problem, exposure to something like drugs, viruses, x-rays, environmental toxins. All of these are possibilities of why or causes of speech and language impairments. There are some other possible causes of speech and language impairments, such as developmental disorders. So if there was brain dysfunction in a child, they might, because of that, develop a speech and language impairment. If they had hearing loss or if they struggle with autism, the autism spectrum disorder, they may also have a speech and language impairment. There are acquired disorders, so ones that result in injury or disease or even environmental. For example, aphasia, so the loss of language functions, a traumatic brain injury that follows an accident, that could be an acquired disorder that then has negative impacts for speech and language. That could cause an impairment. Meningitis is a common pediatric disorder that it actually causes the brain to become inflamed, and that's scary but pretty common. A complication of that can result in hearing loss, and that could cause an associated communication deficit. Speech and language problems could result from an illness such as that. And then I briefly mentioned cleft palate or cleft lip. This is something that a child is born with. The upper lip is either is split, or there is an opening in the roof of the mouth. This happens just because the bone and the plate tissue do not correctly fuse during early weeks of fetal development, and it just happens sometimes. It can be surgically corrected often, but speech is a common issue in students with a cleft palate. Language might be the most complex human behavior, yet despite many differences in child raising across many different cultures, almost all quote-unquote normal children develop their native language at about the same chronological age. So most children appear to learn their language system, no matter what it is, in a matter of a few years without any formal instruction. Right? I mean, we talk, we read, we sing, and they just start to pick it up. They're not taught how to talk or how to listen. It just naturally happens. So there must be some variables influencing how that is learned. Let's talk about that. There could be biological preparation, like neuromotor capabilities. It could be a supply of attention and perceptual abilities that just exists in a child. They're born with it. And I think that some children are. They just want to read. They pick up language quick. I think I did, and I think my daughter did, and my third-born son did, my niece did in those videos, but my middle son didn't. And I read to him, sang to him, did all the same things. It's not his thing. Mathematical, logical things definitely are. There is a successful nurturance that must exist in order to develop language. So a nurturing environment, responsive adults that listen to babies' needs, respond, have those early interactions, that back and forth, that's definitely a part of language learning. Then there are sensory motor experiences. When adults help infants construct their understanding of the world by physically or mentally acting on it, and they're reading books and they're taking them places and they're seeing many different experiences, because that's how children learn different words and eventually learn to read. They connect things to their prior knowledge and prior experiences. So if a child has been to the zoo, then when they're learning to read about animals, they have that mental picture, that schema to turn back to and remember. So that's kind of a part of linguistic experiences. They play a huge role in language learning. Caregivers facilitate language by adjusting phonological, semantics, syntax, and pragmatic characteristics of their speech when they talk to infants. But there are environmental and developmental differences as well. So development of mature language skills is going to require an environment that provides lots of communication and interaction. In every culture, language develops within the context of social relationships, primarily the parent or the caretaker and with the child, but it could be an extension of that with siblings, with cousins, with aunts, with uncles, grandparents. That is going to be a part of how language and speech develop as well. There's still going to be risks for developmental language delays. This could happen during infancy, early childhood. It could be caregivers respond when they're responding to non-linguistic communications, when they're decoding linguistic attempts and providing adequate models for and shaping the expression of languages. But when those are the things that need to occur, when those things are not happening, then the child is at risk for being a little behind in speech and language development. So if a child is not spoken to, not read to, not exposed to words on a daily basis, even if that means sat in front of ABC Mouse all day, every day, or educational programming on a screen, that is not how language develops, because that's very passive. It's not interactive. It's not a back and forth where you pick up eye contact and nonverbal communication. That puts children at a risk for developing a speech or language impairment. We talked about receptive language and expressive language, but just to review, receptive is the ability to understand what is meant by spoken language, and expressive involves producing the language. So if you have a difficulty due to an expressive language disorder, you would have a limited vocabulary, you may use incorrect grammar or syntax, you may have excessive repetition of information. You may have difficulty formulating questions, all in the expressive area. If you have a difficulty in the receptive, it's pretty much the same things, but you're understanding with it. So you may hear all of the words but not understand all of the meanings. You may have a hard time following just oral directions. That could be very confusing for someone. It could be responding to questions appropriately because you didn't quite understand the question. And one of the biggest signs that I've noticed if there is a difficulty in the receptive language area would be difficulty in understanding figurative language or humor or sarcasm. And again, you have to remember that you can't use sarcasm with children under a certain age, I would say 7 or 8, because they really don't understand that. But when they should, if they're having a hard time understanding that, that could be a difficulty with receptive language. How do you know if a child has a speech and language impairments? Well, we talked about those milestones and you saw some examples and you saw an example of articulation, but the best thing you can do is really get familiar with typical development in speech and language. Because when you start to notice that, wow, this child isn't doing the things that they should be doing at this age, the sooner you get an assessment or you suggest an assessment or a referral, the sooner they get services, the more likely they are to turn that around and shorten that gap. That's very, very important. And the sooner students who need speech and language therapy get it, the faster they are out of it and the easier they catch up. Assessment is one of the things that is done, and there are lots of different tools. They should be a variety, informal and formal. It's important to assess them just on a case-by-case basis, but just with everything encompassing. So identifying their gender, their age, their parents, their family background, any family status or history is very helpful. For example, when my child was going through the speech and language assessments, they asked, what was my pregnancy like? What was my labor like? They wanted to know if there was any trauma, anything that could have impacted his speech delay, which was very interesting. And honestly, it was intimidating and awkward, and it was upsetting as a parent to go through that. It made me feel like, oh my gosh, what did I do wrong? I obviously caused this. And that's not the intended response, but they're just trying to get absolutely all the information that they can. A family-directed assessment may be done for younger students, so preschool, toddlers, infants. This would focus on things that the family needs, like any needs, concerns, priorities that they wish to have addressed. This is most useful in the younger ages because families get to participate in the assessment process and they're a bigger part of it. Not that they aren't a part in IEPs and evaluation once school starts in kindergarten, but there's a bigger involvement under kindergarten. And then there are articulation tests. That's a formal procedure used to identify sounds and phonemes that are not being pronounced the correct way. So there are a lot of different ways to assess. The Goldman-Freestow, I always say it wrong. The Goldman-Freestow test is an articulation test. It measures articulation, and it gives an accuracy score of production. So they evaluate the sounds in consonant sounds at the beginning or the initial sound, the middle, and the final positions. So this is a very common one. And then there's usually a language sample. So this is something that a speech and language pathologist or a psychologist will come and just watch and listen to a child in their natural environment. Hopefully it's preschool or a social situation, not just at home. And they'll write down and observe, or they'll write down what they're observing in a very objective way and try to pick up how that child is communicating and what sounds they may be not using, or if they're combining sounds. There's also some pre-linguistic communicative behaviors. So these are things used by child before the formation of formal speech and language characteristics that are assessed. So that could be, let's see, what would be an example of that? Maybe like before they have the words to say stop, what are they doing? So when they get upset and they want something to stop, and there's a student nearby and they're getting closer and closer, does that child push? Do they move? Do they cry? Because that is also a form of communication. So it's just before the language starts to develop. Let's say you have a student with a speech delay, articulation issue, some sort of speech and language impairment. There are lots of things that you can do in your classroom, but before you just start to do all of these things, I would tell you to slow down, see what's written on the IEP, and talk to the families because they're going to have the most valuable information. Besides that, here are some recommendations and considerations that you can implement in your classroom. I would say to do as many of these as you can before an IEP is written because they're easy to do. Modeling correct speech should be done with everyone. Number 9 is being patient. 8 is don't ridicule or point out differences. Those are simple things. These aren't things that you have to wait for an IEP to be written to do. If a child needs more wait time and they have a hard time, you know they have a hard time understanding, give the directions slowly, repeat them, maybe give them one-on-one. There are lots of things that you can do as a teacher for a variety of ages to help a student with a speech and language impairment. The majority of students who have speech and language impairments are served in regular classrooms. That's about 87%, but about 5.1% are pulled out into a resource room. My son was one of those. In general, he was in his regular classroom for most of the day, but then once a week for about 30 minutes, he was pulled out to work on very specific articulation goals and pronunciations. 4.2% are in a separate class, pulled out entirely and just educated in a separate class, like a separate class in a typical school. And 3.7 are in other environments altogether. But the majority of children who have speech and language impairments are in regular classrooms. So you will have them, many of them, in your classroom all the time. There is a lot of technology out there for students with speech and language impairments. Augmentative and alternate communication, otherwise known as AAC, is something that uses symbols or aids, strategies, techniques, something used to supplement or to be alternative to the spoken oral language. Aided technology refers to tools external to a person, so maybe nonverbal means of communication like facial expressions, gestures, and this could include sign language. Using sign language can be beneficial for many students, not only those who are hearing impaired. I actually sign in my preschool classroom all the time. There's low tech, augmentative, and alternate communication. So that would be like picture communication symbols. I have a picture schedule in my classroom. It has words and pictures, and it's in a certain order. So individual picture schedules are another thing that can help students. And there are speech generating devices, or SGDs. So this is more of a high-tech AAC. It involves picking symbols or words to create speech sounds. It could be an individual resource that a child uses, or it could be something that is, I'm trying to think of what they're called, and I can't think of it right now, but it could be an individual board that a student uses if they have no ability to produce sound. It could be something that just helps, like an iPad app, that when they're having a hard time putting their ideas into a sentence, they can pick the pictures and then it produces the sentence. The American Speech, Language, and Hearing Association has 4 guiding principles regarding speech and language impairments. First of all, practices should be family-centered and culturally and linguistically responsive. This sounds a lot like developmentally appropriate practice in early childhood. So they should be specific to the family cultural needs. They should be developmentally supportive, and they should promote children's participation in their natural environment. It should be comprehensive, it should be coordinated, and team-based. So the parents, the child, everyone's a part of that team. Most importantly, it should be based on the highest quality that is out there. And that might be my favorite one. For young children, there are some specific things you want to know about speech and language impairments. First of all is Public Law 99-457, and that mandated that speech and language pathologists evaluate and treat children between the ages of 3 and 5. So when providing services to children who were infants, toddlers, and preschoolers, an assessment involved the family, like the strengths, the needs, and the interactions. And they pointed out that that was just as important as the evaluation of the child. When you're assessing children, very young children, that many of those developmental scales look at language as a part of the assessment process, because when we assess young children, we assess the whole child. It's not like teaching 8th grade English. You're teaching in 3rd grade and under, because 4th and 5th grade is now a part of early childhood, but you tend to have a specialty in that age group as well. You may teach science and social studies, but definitely 3rd grade and under, you're teaching all the subjects. So when we assess children, we're assessing them in every developmental area. So English language learning, that's a part of the formal assessments. Preschoolers with speech and language impairments should be in general education classrooms. Being around daily interactions with peer models and exposure to those rich language experiences are going to help them do better developing their speech and language. Often we have young children who come to our preschool and the parents say, we went to the pediatrician and they're concerned about speech, so they said to get them enrolled in preschool. That doesn't mean that after a year of preschool, bam, they're going to be fixed and no more language disorder, no more articulation issue. But being in a classroom where there's a quality classroom, I should say, rich experiences, books read, songs sang, lots of language, that's going to help. It's not going to fix everything, but it's going to help. And then you're going to have some very knowledgeable teachers who are going to pick up and notice, wow, they don't use the S sound, and they should be making that sound by now, or their L's aren't coming out yet. And then they have the conversations. I have many of these conversations with parents that say, by this age, we should be hearing this sound. How do you feel about getting an evaluation and seeing if they qualify for some speech therapy? What about adolescents and adults? Well, they encounter very similar situations. Sometimes I feel like they struggle more because speech and language articulation issues are more accepted, in my opinion, in preschool and elementary school. And then if they aren't fixed or mediated, or if people who are struggling with those specific sounds continue to struggle beyond that, that's when kids get mean and they're not as accepted, and it can be even more of a struggle. It can work against them in employment decisions, in living arrangements, and even post-secondary choices. So this can be compounded by other factors. There's a period of rapid change that when a student, an individual, is searching for their own identity, they're coping with lots of different concepts like independence. Communication can be exacerbated by all of those things, and it can tend to get worse. Working effectively with adolescents who exhibit speech and language impairments requires a lot of understanding and empathy from the speech language pathologist, and I would consider them to be your biggest resource if you work with middle school, high school, or adults in education, and any of them have those speech and language impairments. There are appropriately designed family-centered interventions that are based only in part on formal assessment. This includes parents and family members as active participants in assessment, and involvement from the most intimately involvement with children, increasingly effective in treating communication disorders. The more involvement you have with the family, the more on board they are, the more they're doing the same things that the child is going through in therapy or working on in school, the higher the success. The role of the speech and language pathologist is they need to learn as much as possible about the child's activities in lots of different environments. That way, they can involve everyone in that intervention process. So, for example, when my son became kindergarten, he started to see a speech and language pathologist in the school, and she called me a lot. She was wonderful. She wanted to know a lot about Nolan, and we filled out some interviews, and she wanted to know who he lived with, what he likes to do, what kind of animals he has. That way she had talking points with him. She didn't want to sit down and start drilling him. And of course, she was a stranger at that point. She wanted to just get to know him. So right off the bat, she knew Nolan had 2 dogs, and one was Fox and one was Bailey. So when she asked him, tell me about the animals in your house, she knew that whether she could understand or not, he would be trying to say Bailey and Fox. The more information and the more teamwork you have, the more successful everyone will be. Let's talk about diversity in language and speech. Well, one result of the influx of new citizens is that 1 in 4 U.S. children has a parent who is an immigrant. That's a lot. This most likely means that the vast numbers of children who do not speak standard American English as their first language will probably need help with some aspect of language. Research suggests that young children from culturally and linguistically backgrounds, in comparison to youngsters from English-speaking households, are less likely to be identified and receive appropriate speech and language interventions. Thereby, it heightens their risk for later academic and behavioral differences and difficulties in schools. You may have heard the term EL, or English learner. That's become popular, and if not, then you will probably start to hear it. EL stands for English learner, and limited English proficient is another term, also known as LEP, that is used in some educational circles, but not as common. Both IDEA in 2004 and the No Child Left Behind Act incorporated these terms when addressing the needs of students whose primary language is not English. We have to remember that you're going to get a variety of children in your classroom each year. And I've noticed that when teachers have a student who is an EL student and English is not their first language, they instinctually just freak out. What am I going to do? How will I teach them? I don't know their language. And I try to remind them, especially in the younger grades, that they pick up English so easy because you're teaching all the time language. No matter what subject you're teaching, no matter what you're working on, what the topic of the day, you're talking, you're singing, you're reading books. You're not just lecturing, especially in the younger grades, and you should never just be lecturing, but you're using visual aids, you're pointing, you're using gestures, you're using nonverbal communication. So they're learning English all the time, just as every other student in your classroom. That's how they start to acquire all of the different vocabulary. So try not to freak out and pay closer attention to those English language learners, as it's going to be sometimes more difficult to see if they are behind in their language development because they may speak dual languages, but they're perfectly capable of learning and speaking both at the same time. Some parents worry about that, and they pick it up so much quicker than we do in middle school or high school when we start to learn a second language. There are lots of different intervention techniques for second language learners, and what I would suggest to you is making sure that when you have those students in your class, that you're very specifically looking over those IEPs, you're attending those meetings, and you question and ask all the things to the school psychologist and the speech language pathologist, as well as the intervention specialist. They're going to have what techniques are working best, and these are changing all the time. So they'll be the ones who are staying on top of those. As always, there are some trends and controversies in all things education. So these are a few. Advancements improving prognosis. This refers to high incidence disability, or an impairment that has far-reaching and pervasive effects. Advances in the areas of early intervention, genetic research, and enhanced assistive technology continue to improve the prognosis for those with speech and language disorders. Common tools for assessing speech and language skills will continue to be reviewed for their adequacy in measuring linguistic abilities of children who are increasingly multicultural. There's controversy regarding etiologies, the causes. This happens in everything, but this can vary from the disorders such as CAPD and stuttering. There's an increased understanding of the underlying neurophysiological basis for problems like those. And there are education management strategies for these and other disorders, and these will continue to improve. So whenever you hear about one of these controversies, just stay on top of the research and try to be patient because it's still new. Lots of digital technology is out there, and this is where another controversy comes into play. So are all of these technologies good? Are they not helpful? Are they backfiring? In a lot of ways, there are things that are helpful, and when and if a child needs a digital, really it's more of assistive technology in the classroom, I say use it, just as I am currently on crutches because I had knee surgery. It's not everyone needs crutches. I need crutches right now because I cannot walk. So if a child is struggling to articulate their thoughts, give them the resources they need. It's not going to make them lazy or dependent on it. It's going to help them be successful. However, not all of the technologies out there are quality. So it's not always going to be your job to evaluate them, but when and if you hear about one or a parent asks you about a new resource, do your research and find out about it and see, is this something that you're doing already, or is a different app or tool able to provide the same services? Maybe this is something that would be helpful. Just try to never give up on learning, because when you are done learning, I guarantee you are done teaching. Things change so often in this field that you will never know everything. And honestly, that's what I think the best part about education is. So keep researching and keep learning.